Hi, I'm Dr. Laurel Mark. I'm a recently retired internal medicine doc in Madison, Wisconsin, and the co-chair of Wisconsin PNHP. I spent almost 40 years taking care of patients, and over that time, I had to experience the relentless encroachment of corporate medicine into my clinical practice. Like almost every doctor I know, I devoted myself to the study of medicine so I could help people stay or become healthy and be with them to help relieve their suffering. Building real relationships with our patients allows us to be partners and guides and forges a bond between doctor, healer, and patient. Nothing is more sacred in medicine than that relationship. That bond of trust and compassion is an intrinsic part of therapy and healing. I've seen the power of that bond from both sides. When I was younger, I myself had a miscarriage, which required surgical intervention, a scary and traumatic event. My OB, Dr. Barbara Brew, stayed late and saw me through this, and at the end, thanked me for coming to her and allowing her to help me. She said that I had given her the gift of my trust, and she was grateful for that. She was a true mentor to me and taught me to do this in every patient interaction I had. The erosion of that relationship is at the core of what's wrong with our system. And it is a direct result of the corporate for-profit takeover of medicine and the intrusion of profit-driven companies into that relationship. Those entities want to change the doctor-patient relationship from one of trust and mutual benefit into a simple economic transaction. It makes patients feel abandoned and angry, and it's profoundly demoralizing for doctors, nurses, and health professionals. We see the consequences of this ongoing assault on our ability to be doctors and healers when large portions of the public don't trust doctors and health professionals anymore. Think about the recent grim news that over 1 million Americans have died from COVID, astronomically higher than in our peer countries. Most of those deaths preventable had the public trusted us more. I oppose direct contracting and REACH because it undermines the foundation of healthcare, which is the bond between doctor, healer, and patient. It gives non-healthcare for-profit entities the power to decide about our personal medical care and devalues the doctor-patient relationship yet again. I'm especially outraged by the assertion that patients can opt out by finding another doctor, as if that were possible. This is so disturbing from a policy perspective because it treats doctors and healers as interchangeable cogs in the corporate machine. I want doctors and healthcare professionals working in partnership with their patients, making those medical decisions. So what have we done here in Wisconsin to stop direct contracting and REACH? First, we educated ourselves about the program so we could also educate our members and our partner organizations. We coached members to contact their representatives in Congress. We worked with partner organizations to mobilize a broad coalition. We're in regular contact with our Congressman, Representative Mark Pocan, who has been a champion on this issue. But we know we need to do more. This summer, we plan to publish letters to the editor and op-eds, do radio interviews, meet with legislators, and bring more groups into our coalition. And we've marked our calendars for July 30th, Medicare's anniversary, a perfect day to take action to protect our nation's most important health program. We also learned that anybody can make a difference. You just need to act. Educate yourself and your neighbors, call the president and Congress, sign and share the petition, and bring as many people as you can into our movement to protect Medicare.